Thank you very much. Thank you for the introduction. I'm delighted to have the opportunity to share with you BMF-219's ability to restore beta cell function and balance beta cell mass by rebuilding the pool of beta cells with proper proportion of the beta to alpha cell ratio. Our understanding of the progression of diabetes and the underlying cause has evolved. It is now clear that beta cell loss is the common enemy for both type 1 and type 2 diabetes. Because of this, BMF-219 has the potential to be a true disease-modifying treatment for patients with type 1 and type 2 diabetes. Menin serves as a key checkpoint. Excessive activation can suppress beta cell homeostasis, preventing beta cell recovery. BMF-219 has the ability to impact this key checkpoint through disruption of the menin-based protein complex. BMF-219, a potent and selective covalent menin inhibitor, exerts global control of the protein, resulting in 90% reduction of MEN1 expression at 6 hours. The Zucker diabetic fatty rat, a model of insulin resistance, was the first model and first diabetes in vivo experiment attempted with BMF-219. Because of the model's focus on insulin resistance and BMF-219's effects on beta cell recovery, we weren't sure what efficacy, if any, would be seen. The study consisted of 3 treatment groups: vehicle, BMF-219, and pioglitazone, all dosed orally once daily for 16 days, followed by a 2-week washout period. The purpose of the washout period, typically not seen in diabetes animal models, was to measure the durability of BMF-219's effect, presumably the durability of the newly formed beta cells. An oral glucose tolerance test was conducted at day 15. BMF-219 displayed strong glycemic control through the 2-hour assessment period. Most impressively, animals at time 0 for the 219 group were in normal range, and the level did not much move beyond the starting glucose level after the administration. BMF-219 also significantly reduced blood glucose at 4-hour fasting and non-fasting conditions, as well as demonstrated insulin and C-peptide compared to vehicle reductions at day 17, highlighting its glucose-lowering ability without having to overwork the beta cells. Unexpectedly and impressively, BMF-219 displayed statistically significant reduction in HOMA-IR, a measurement of insulin resistance under the 4-hour fasting conditions and non-fasting conditions. BMF-219 also showed statistically significant reductions in cholesterol and triglycerides, as well as a 15% body weight reduction after just 2 weeks of dosing. At day 29, a second oral glucose tolerance test was conducted following the 2-week washout period. This was used to test the durability of BMF-219, an agent focused on the reestablishment of beta cells. 75% of the glycemic control displayed while on treatment was maintained after cessation of the drug, following just 2 weeks of dosing. At day 31, BMF-219 displayed reduction in blood glucose and generated responsive insulin and C-peptide under the 4-hour fasting conditions. Immunohistochemistry and image analysis were performed on pancreatic islet tissue sections from the ZDF model experiment at day 17 as well as day 31. A board-certified pathologist oversaw the conduct of the algorithm-based image analysis for quantification of insulin and glucagon to quantify beta cell and alpha cell area. Importantly, the pathologist noted an increase in cellularity in the pancreatic sections from the 219 group compared to control. As expected, both the vehicle and pioglitazone groups displayed reduction of the beta cell area due to the progression of the disease. The BMF-219 group, however, despite the 2-week washout, displayed robust beta cell area. BMF-219 also demonstrated strong beta cell activity with HOMA beta assessment at day 31, achieving normal beta function despite the measurement taking place post the 14-day washout period. The STZ rat with a high-fat diet is our second model and our second in vivo experiment with BMF-219, which also displayed striking results. In a study conducted by Yang and company, MEN1 excision prevented development of hyperglycemia in rats treated with STZ, which served as strong rationale for studying BMF-219 in this model. The study design consists of the same 3 treatment groups: vehicle, BMF-219, and pioglitazone, again, all dosed orally once daily for 16 days. Day 1 of dosing commenced post 2 STZ injections, administered 1 week apart, followed by a 1-week recovery period. This model results in the destruction of approximately 50% of the animal's beta cell mass to generate the type 2 diabetes setting. Once again, BMF-219 displayed strong glycemic control through the 2-hour time point during an oral glucose tolerance test at day 17. And looking at the non-glucose conditions, BMF-219's effect appears to happen by day 8. BMF-219 also demonstrated strong beta cell activity with HOMA-beta assessment at day 17, a near doubling of beta cell function after 16 days of dosing. In the STZ model, BMF-219 showed statistically significant reductions in cholesterol and triglyceride, as well as a 7% reduction in body weight after 2 weeks of dosing. And as a thank you for attending this presentation and coming all the way to Stockholm, I'd like to provide a sneak peek and share with you some initial data from our human donor experiments. Human donor microtissue islets, which mimic a live human islet found in the pancreas, was exposed to 2 concentrations of BMF-219. The algorithm-based image analysis uses dynamic thresholding for beta cell detection, displayed statistically significant increases in beta cell count and beta cell fraction. These results, along with additional work, increases our understanding and our confidence in BMF-219's ability to restore and balance beta cell mass effectively and efficiently. BMF-219 was tested in 2 type 2 diabetic in vivo models at clinically relevant exposures. BMF-219 displayed statistically significant improvements in insulin resistant instance in the HOMA-IR measurement in the insulin resistant model ZDF, and statistically significant improvements in beta cell function with HOMA-beta measurements in the beta cell deficient STZ model. We're very excited to continue development of BMF-219 as a novel treatment for diabetes and look forward to sharing data from future experiments, such as the type 1 diabetes model. Thank you.
Okay, thank you very much. This is open for questions. Go ahead.
Bruno Vergès, Dijon, France. Very nice presentation, congratulations. How do you explain the body weight reduction you observed with BMF-219?
Yeah, great question. I think there's certainly a contribution due to appetite suppression,
Okay.
But we can't explain the entire body weight reduction.
Okay, thank you.
Mm-hmm.
Hi, I'm Wei Xuan from the National University of Singapore. So it is known that the loss of menin can lead to the formation of PNETs, pancreatic neuroendocrine tumors. So do you have any long-term studies showing that your BMF-219 treatment does not result in tumor formation?
Yes, that's a great question. And so the critical piece for BMF-219 is that we have transient reduction of menin and not chronic reduction of menin. And then it's not 100% or complete knockout. And so when we look at proliferation rates, we only see proliferation rates under glucose setting. When the animal is in the normal range, the proliferation stops. So it's almost a fine-tuning mechanism.
So just 2 comments. The one, the effect on the fasting glycemia is pretty impressive in both models, in fact. Mm-hmm. It's more important, I would say, than in the effect on the OGTT, because the 2 curves are parallel. They're just much lower. Mm-hmm. And so I had obviously a question also on the safety issues, but it was addressed here with the seeing that it has a a clinical relevance with the MEN1 patients that have all these different tumors. So I agree with that. Where's my question? Shoot. Ooh. Yeah, so I had a question on is it going to be kind of the magic bullet approach? So how are you going to make this specific for the islets? Are you going to inject it IP, that it would basically go to the liver and maybe to the pancreas? And is it important to do it seems important to do the washout. So do you have more information on that, of kind of how you would translate into a human setting?
Yeah, it's a great question. And BMF 219 is dosed orally, so there would be systemic exposure, but we do observe that there's high concentration of BMF 219 in the pancreas. So it is pancreatic directed concentrations. And from a treatment perspective, we don't believe this would be a chronic treatment. This would be a finite treatment. So we need to understand how much time do you need to dose the patient for in the acute setting. Is it 4 weeks? Is it 6 weeks? Is it 8 weeks? Grow the pool of beta cells, and then we would monitor and look at the durability of those newly formed beta cells. Is it in the order of 6 months, or is it in the order of years? We have to explore that.
And also the repetitive, now that you've started, I saw the human islet stuff. If you pulse and chase them, how long can it work for? Or at a point, are they going to get exhausted? It'd be interesting to go further in that. Well, fantastic work. Thank you very much.
Thank you very much.